This is just a quick video reminder of the techniques for the ScarWork Certification course. I'm going to be using this black line to represent the scar for the demonstration. I'll just quickly talk through each of the techniques, a quick reminder of hand placement and so on, just to support you in your learning. So if this is the scar, generally speaking, the first technique that we would be using, unless somebody's got extreme sensitivity and they can't stand the feeling of the movement, would be your featherlight sweeping. So a hand bracing away from the scar, and then you're sweeping, so the bracing is the holding, and then you're sweeping in your hand with the featherlight sweeping is moving before you touch the scar and continues moving after you come off. You'd go in both directions if possible, up towards the scar from either side, really feeding up into it. And don't rush this technique. You should really use this to warm up the whole area and go much wider than you think. Think about where the disruption's been in the tissues and then go wider again. So if you've got your combing, so combing, generally speaking, you're thinking about the muscle, the fibres of the scar being quite knotted together and kind of twisted, almost like you're trying to separate out those fibres. So in some cases you may be bracing if your scar is going to move around a lot. If it's over a very tight area, you don't have to brace, but you're going to be doing little short strokes using the side of the finger or the side of the thumb, almost feeling as if you're trying to ease out and separate out those fibres. So this is really quite precise and quite delicate. And the thicker the scar, the longer that you may take, because you may have to go back and forth more times to try and think about separating out those bulky fibres. So that's combing. Your touch is incredibly superficial, ever so slightly deeper than a featherlight sweeping, but it's still pretty light. You've got scraping. With scraping, you line your fingers up so that they're going to make a little scraping tool. You need to make sure that they're together because you're trying to draw hydration through the tissues. If your fingers are separate, those fluids are just going to slip away. So with lined up fingers and hand bracing, you will start probably a little bit closer to the scar and feed in, and then slowly take that wider and wider, always just coming up till you touch the scar line. Make sure that you reach the scar line because the most congested tissue will be just around the scar. So if you're stopping short, you're not really helping them so much. If at all possible, you want to do both sides of the scar. If it was a bikini line scar such as hysterectomy or C-section, you would have to brace above and tighten the tissues from this direction in order to be able to scrape from below, because it wouldn't be appropriate to scrape to brace in the pubic line. You've got filling. So filling is generally for a here I've got somebody who's had a lumpectomy, for example, so they've got a more round scar where the surgeon's gone in and taken away tissue. So then I'm going to use my filling, which is more of a scooping motion, and you can either be completely up in your fingers. Sometimes I like to just rest my hand down just to really create something to scoop in against. So this is going to be for keyhole procedures, anywhere where there's a dip where tissue's been removed. So it could be carcinoma, melanoma removals, that kind of thing is where you're going to be using your filling as opposed to scraping, but the action that you're doing is both the same. Scar or multiple scars, so this might be multiple spinal surgeries, multiple hip surgeries. Squirrel can be quite a nice one to use. Sometimes I use it on a C-section if I'm working from below, because you can't really brace below the scar. So in some people, doing a little bit of squirrel. So it's two hands, it's lighter than scraping, it's moving up towards the scar, and it tends to be that you've always got some contact with them. Delete key is one of my really favourite techniques. It's subtle, it's easy, and it can have a really good effect. So whether that's if you've been working along a scar line and you find that some of the tissue feels a bit thicker, a bit more fibrotic, feels a bit knotty, a bit denser, then just coming in with a delete key, it's a soft push into the tissues, pushing onto that hardness, that fibrotic tissue. You can use it when working over a breast. It's really nice in soft tissue. You can also use it when working around a hard area. And sometimes you might have a scar that's a little bit hypertrophic, so the scar itself is sitting up, prominent to the skin, in which case I'd use my delete key to try and soften and flatten that scar, encouraging it to go down. So it's quite soft and it's very non-irritating. If you've got a really big area, you can come in and do delete key with a few fingers as well. Should be really nice and slow, nice little rhythm to it, just pushing into the tissues and coming back out again. Delete key. In terms of warming up the broader area and starting to sink into the deeper tissues, you've got your cat. So here you would be just gently pouring into the tissue. So you can now see that I'm making the pillow move quite a bit. Sometimes I might be either side of the scar, trying to mobilize it and move it around. Other times I may just work from one side. Perhaps if I'm working abdominally, I feel the scars pulling down in one direction, I may be wanting to lift out of that. So just lightly sinking into the tissues just until you feel a bit of resistance and then easing off. And you can stay in the same place, don't feel that you need to move all the time. Sometimes if the scar feels really cut down, what I might do is try and get some loose tissue and try and lift that scar up and get my cat really directional underneath. So that might be, again, if you've got somebody who's had a more keyhole procedure, or somebody whose scar looks good on the surface, so you can't really see much on the surface, but what you feel is a thickening underneath. You may then be using your cat. You need to be far enough away, because this is the thick fibrous tissue underneath, to be able to really try and soften that tissue, that fibrous tissue that's fallen underneath the, built up underneath the scar. So that's cat. I would be using cat in almost every treatment. I would be using combing and scraping in most treatments, if not filling, and I would always be using featherlight sweeping. If you've got a person who's got a very numb area, you really want to be stimulatory, then I would be looking at your more frictional moves. So that would be, the strongest one is a razor, so that's when you're pinching your finger, hold the tissues really tight. This one is going to be more tiring on the forearm and arm, so I'll do it in little bursts and work on an area and then move my placement hand, because you really need to be just selecting a small bit of tissue with this and working in between your brace. So this is what I'm doing. It should feel quite enlivening to the person. There shouldn't be any discomfort. If there was, you'd stop. You've also got your zigzag sewing machine, so this is very good for stitch marks. It's much lighter, much looser, a little bit more free flowing, so you can go back and forth across the scar line if you've got stitch marks. Again, if you've got somebody really with a lot of numbness, I would use your zigzag sewing machine to work over that area. Then you've got two techniques which you can use for a linear scar, which is quite stringy. So that means if I put pressure on either end of this scar line, I would feel then that the rope, it's got some ropiness to it, that almost like a string pops up if I was then to palpate this bit in the middle. So you've got your piano, where you lie your fingers along the scar and then you're pushing down, all of the fingers remain in contact, you push down with one finger, and as you do that you may feel along the scar line that something else is pushing sort of up against you, and then you respond to that, and what it looks like is that your fingers are wiggling up and down and you're playing the piano. So this is very good for stringy scars. It's also good for cording, so something that you can do, and it's very non-abrasive, so it would be more suitable for something like cording in the axilla, where there's a predominancy that somebody might be at risk from lymphedema. So the other technique that you can use for a ropey scar, so this is a scar when you put pressure on either side of it, it pops up, it's quite thick and stringy. That would be inchworm. With inchworm, you're just going to kind of work your way along it. It should feel quite light. If I break it down really slowly, you're pushing, sliding, holding, pushing, sliding, holding. But actually, this should feel like quite a smooth movement. You can either do it kind of up on your fingers like this. If it's a very small scar, you might kind of feel you're sliding back and forward across. But the point is it actually should be quite flowing. It's not a pull, stretch. But if you break it down, that's what you're doing, but you're doing it in quite a fast flowing and smooth way. If you're working anywhere where there's a lot of soft tissue, so this would be abdominally, in the glutes, sometimes in the thigh, then a really nice technique is to do your dropping. It is one I'd really encourage you to practice at home, just maybe when you're sitting and relaxing in the evening, on a chair, do it on your own leg, practice on a partner. You don't need to lift your hand up very high, and you need to make sure you've got a really nice looseness through the arm and forearm. Your shoulders are nice and relaxed, because the more tension that you convey, the less pleasant it feels for the person. You can rest your other arm just somewhere else on their body that's appropriate, like over the cover on a leg or on a shoulder, for example, and then drop with one arm. If you feel really confident, you can drop with both arms, but just make sure that one hand is off before the other one comes down. What you're feeling with this is that oscillation working through the tissues. A higher tone is tighter, more fibrous tissues, whereas a nice, more hollow, deeper tone will be softness through the tissue. So it's the higher toned areas when you need to persist and continue and stay in that same place and see if you notice that tone changing. So I'd be doing it for a good few minutes. That's dropping. In a small area, you can do it, things like over the breast. I would really be very light. I'd be up in my fingers. I'd be working very lightly, and I wouldn't necessarily be dropping down onto the chest. I'd probably be sending a drop through the breast, sort of more transversely rather than directly down onto the rib cage, which wouldn't feel very comfy. When there's been a surgery, you've got two bits of tissues where all in between you would have had lymphatic vessels, you'd have had little microcapillaries, you'd have had nerve endings, and obviously you've got the fascial connections there as well, all of which would have been disrupted and sort of separated from their partner path when there has been trauma coming into the tissue. And so the technique matching layers is really good for trying to re-establish that connection, trying to get this tissue that used to be sort of interdigitized and talking to each other back talking to each other again. Even if tissue's been removed, I would suggest it's really worth doing this technique in the treatment. As long as you can get some tissue movement, I would use it in every treatment. So it's quite a slow move. You're just going to lie your fingers either side of a linear scar, and what you're going to try and do is just try and get that tissue to find where it wants to be in its most comfortable position. And sometimes you can see kind of almost that the skin looks more comfy, or that it has been a bit twisted as a result of surgery. So you're using then your fingers to try and kind of take that pressure back, try and take the tension lines back to where they used to be and where it looks most comfortable. With some people who work energetically, they might really kind of get that sense of being drawn and take their time with this. Even if that's outside of your comfort zone, I still want you to try and do this technique, and the body will work out where it needs to be. So in which case, just laying your fingers either side of the scar, going very slightly backwards and forwards and up and down, and those bits of tissue that used to be connected may get that stimulation. You've got your technique for drains, keyholes, puncture wounds, anything where something's probed in, so laparoscopies, things like that, is your down the rabbit hole. I tend to use my first finger. What's helpful is to make sure that your other fingers are not also in contact. So if you feel that you might be more comfy, perhaps laying a towel or something nearby so that you can rest and again be relaxed with your hands. Have the intention of thinking about the direction that the probe or the drain might have been sitting in, and making sure the soft part of your finger is angled towards that. So it may be, if you knew that they were going in that direction, that you'd want to angle your fingers, the fatty soft part of your finger pad is pointing in the directions, because that's the bit that's got the most nerve endings in it, that you'll get the sensation of the sinking into the tissues. And again, take your time with this, don't put yourself under pressure, and just check in with your client. How are you feeling? Is everything okay? Do you have any sensation here? Slightly deeper techniques, which would be a skid. So that might just be a small movement. You're sinking onto the tissue and you're drawing it. You would nearly always be skidding towards the scar line. So you're never pulling a scar apart, but you're trying to release through it. So if this scar was a bit stuck here, I would lay my fingers behind it and I would do a drawing movement. So that's a skid, sinking into the tissues, getting to the depth at which I feel that the tissues is stuck, and then pulling in towards the scar. If that's a big picture skid, then you might be using two hands and moving a much bigger plane of tissue. So that might be a skid across the pubic fat pad if you're working post-hysterectomy or C-section. It might be you've got the client sideline. If you've got a hip scar, you would put your hands, it tends to be that it's slumped towards the glutes and needs drawing forward. So if this seam here was my hip scar, I would place my hand so they were slightly behind it, and I would be drawing up towards the midline. That can be altered depending where you are in the body. Just think about where do you need to bring the tissue to, and the purpose of the skid is so that when you're trying to do something like cat, perhaps you haven't got enough tissue movement, and so you're skidding to release that tissue so that then you can come in and you've got more looseness. You've got fatty breast slumps. So if I get my breast back again, this starts off with a sort of soft walking through the tissue, so sinking in one finger at a time. I also think this technique is quite nice to use on the abdomen. And then if you come across what feels like a fatty lump, you'd always have wanted them to have had it checked out first with a medical professional. You would then do some gimballing on that. So gimballing is a term that Sharon used. It just means to kind of rotate your weight, trying to capture a piece of more hard or fibrotic tissue, and then you're using the weight of your body almost as a lantern moves at sea. So you're swaying and rotating on that to try and find the right angle at which to allow it to release. You can do it one-handed or two-handed. Then you've got the two types of flip. So a twist and flip is used where you've got an overhang of tissue. So if that's my scar, I've now given it an overhang. So a twist and flip would be pushing up into the adhesion and coming out. You can do it with little finger. I tend to use my index finger a lot. Sometimes I go in with my thumb. The point is you push up into the tissue and then you pull back the way you can. The other move where you've got a scar that's indented is the double flip. With your double flip, you want to rest the flat part of your finger along the scar line and try and get as much of your finger in contact with the scar as possible. So that might mean lifting the other fingers out the way like this. Sometimes I tuck them in behind and just kind of try and keep my thumbs out the way so that you're laying along the scar line, and you're going to start with both your fingers in parallel, nails facing upwards, and then as you go in, you rotate into the scar. So what you'll see is you notice my elbows and my shoulders moving more than my hands. So the twist is coming from the arms. So you push into the scar, take your time going in and then come out quickly. So pushing down into the scar and then flicking back out, down in, flicking back out. And make sure that your fingers are touching together and that they're on top of the scar line. Here's an example of me in classroom using the cartilage technique. This technique is applied usually for the ears and the nose. Think about clients who might have been in a car accident or had trauma where it feels like the cartilage has got damaged or broken, or perhaps their nose is twisted, or if they have recurrent problems with sinus. It's a very light hold. You want to make sure that you're listening to the body, and you may feel that you want to rotate and kind of fit two pieces of broken cartilage together. So a very traditional scar technique for a scar like this would be literally to pick the scar up and do a deep roll through it, which is really quite unpleasant and quite aggressive, and that's about kind of ripping it off the tissue below. So we don't use rolling on flat scars with scar work. But if we've got, and we have got a couple in the room, if we've got a scar where you can get comfortably either side, perhaps it's around a finger, and you can kind of roll all the tissue, or you can get either side of the scar and do some rolling, it's a bit like being able to move from both sides. So just finally to say, I really hope that you've enjoyed the course. It's been wonderful sharing these techniques with you. I kindly ask that you please don't share this video outside of anybody else who's done the training. This course takes a long time to put together, and it's really important when you're watching the videos. It might look like I'm going a lot firmer, and I'd hate for somebody to try these techniques if they hadn't had the classroom training as well. Good luck everyone, keep in touch, and I can't wait to hear how you get on.